everyone recognizes the value of good health. Hawaiian Gardens is fortunate to have a world-class hospital located in the city. We spoke to the new CEO of Tri-City Regional Medical Center about developments in the hospital.
We have an obligation and a moral obligation as a nonprofit hospital to do contributions to the community. We provide lectures, to the parents to make sure when they're providing lunches for their children in school that they're healthy, that they're satisfying, and being in an economically depressed neighborhood of some extent, financially at least, we make sure they can be affordable. So we have 2 people on the staff, plus our dietitian, who teaches them the value of fruits and vegetables and staying away from carbohydrates, staying away from fats, and so these kids can grow up. We also physically support the school system, where we've had physicians go to the schools, discuss the career, discuss health care, preventative measures of how to do this and how to do that. We also give vaccinations and exams to all the athletic teams in the city to make sure that they're healthy before they go out in their athletics. A lot of these people do not have regular physicians. So our physicians volunteer their time, take blood pressure, take temperatures, give flu shots when necessary, and then give them ways of eating more and being more healthy. Last year, in our needs assessment, we showed that we gave $10 million in cash or uncompensated care to the general community. So I'd like to expand that, with education, to do health fairs where we get seniors to do blood pressure, give flu vaccines, to teach dietary needs, and basically consider this a safety net for the community where everyone is welcome, regardless of their ability to pay. We have an emergency room that's 24/7, and we have a full range of physicians. We're small compared to some hospitals, but we have all the technology of the larger hospitals. Last year, in all our upgrades, we invested over $10 million. We have a new entrance, a new lobby, new desks. The outside has been painted. Then we went to all the patient rooms, We've got new beds, new overbed tables, new curtains. Then on the technology side, we have the latest in MRIs, CT scanners, and in the operating room, where we have 4 major surgery operating rooms, we have the latest equipment with C-arms, radiology equipment. So we have the technology of our big sisters and brothers, but just in miniature. So any patient coming in here will get the same level of care they would at some of the larger hospitals in Southern California. We are accredited by all the national agencies, and we are a center of excellence for many of the surgeries we do. Nobody comes in here like they would at some place they're going to enjoy themselves. You have to take that into consideration. So we try to treat them with compassion, Any financial matters, we try to handle that way in advance, so that's not an issue when they come in here. We try to get them right to their bedside or to the operating room as quickly as possible. And we treat them with respect and with honor. We obey all the HIPAA rules and make sure none of the information, personal information, is in any way compromised. So I think by being smaller, we can lend that compassion that you can in these large places where everyone's a number when you're dealing with thousands of people. Our infection rates and our recovery rates are as good as any in the country, and we compare ourselves to everybody, not just to ourselves. There's always room for improvement. We're never done. Excellence is something you have to have, and you can't afford to even make one mistake. So we try very hard, always to improve, always to do a better job than we did the day before.
We will bring you more segments regarding health and wellness in cooperation with Tri-City Regional Medical Center in the future.